Hey class, so last time we were looking at blood flow and blood pressure, and today we're going to look at exchange that happens in the capillary beds, and then also what happens in cardiovascular disease. Alright, here we go. So if we look at a diagram of a capillary bed, we see that blood is coming from the arterioles. Remember, those are doing their job to regulate the pressure that's of the blood. As the blood enters the capillary bed, it's going to have blood pressure still, and that blood pressure is going to be higher than the osmotic pressure. And so if we think about which way water is going to be forced, then because the blood pressure is higher, water is actually going to be forced out of the capillaries at that end. As it goes, it can carry any dissolved solutes with it and carry those out into the tissues. As we continue to move through the capillary bed, the pressure will lower because of all the surface area and all the distance that it's having to cover. And so we will actually see those pressures start to equalize. When that happens, now things are able to move based on concentration gradient. So if we think about inside the capillaries, we're going to have high oxygen, amino acids, and glucose concentrations that have been carried there from the body. And so those are going to want to go out into the tissues. In the tissues themselves, there'll be carbon dioxide and wastes, and because of that concentration difference, those will want to move into the capillary beds. So we have exchange happening where those pressures are equalized, and then as the blood pressure continues to lower, the osmotic pressure is now higher. Now that's actually going to allow water to move back into the capillary beds before it goes into the venules and goes back up to the heart. So here's that same idea written out in text. So if you need a summary, go ahead and pause the video and you can use this to help yourself with your notes. So that water, the fluid that leaves, it becomes part of interstitial fluid. So that's the fluid out in the tissues itself. Most of that water it's going to come back because of that osmotic pressure towards the venule end. But some of it doesn't make its way back in, and what will eventually happen is within the capillary beds, we also have the lymphatic system sort of intertwined, and so any of that interstitial fluid that isn't taken back by the capillaries can be taken up by the lymphatic system, which will ultimately connect back with the cardiovascular system up in the shoulder. So once that interstitial fluid enters the lymphatic system, that's what we now call lymph. So cardiovascular disease, we've looked at all the functions of the heart, the structures, and how it works, and we've seen that it's really important that it functions properly, that small changes can have a huge impact in the system. But cardiovascular disease is so important because it's the most common cause of death in the Western world, because it's so critical to have such a perfectly functioning system. There are disorders of the blood vessels, things like hypertension, high blood pressure. We looked at a bit last time, as well as atherosclerosis. We could talk about stroke, heart attack, and aneurysm. So hypertension is high blood pressure. So as the blood moves through the vessels higher than normal, it's often due to arterial plaque. Remember when we talked about blood flow, we also looked at plaques. We also talked about if the walls of the vessels themselves stiffen for some reason, that can cause issues, and then changes in volume. So if there was an increase in volume, that could increase pressure as well. But most often these will be caused by plaques. Anything over 140 over 90 millimeters of mercury is considered hypertension. It's often called the silent killer because there are a few symptoms. So unless someone is regularly monitoring their blood pressure, they may not even recognize that they have hypertension. And it can lead to heart attacks, stroke, or kidney failure. And so as we move towards thinking about prevention, this is one where it's really important to have consistent medical care, physicals where you're getting your blood pressure checked so that you can be aware of your blood pressure. So atherosclerosis, we saw this was a buildup of plaque in the blood vessels. It can be associated with a stroke, heart attack, and aneurysm, anywhere where depending where we constrict blood flow. So if we look at an image of what happens, remember there's often can be like a slight tear in the wall of the blood vessel. As that tear happens, you can get the immune system will want to come in and help repair it, which can also cause fat and cholesterol to want to stick at that site, and then you get this plaque that forms out into the vessel itself. You can also get clotting as the immune system tries to repair the tear there, and ultimately end up constricting the vessel. Remember, depending on where that plaque happens will affect the blood flow to a particular area, and then that causes different diseases as well. So stroke is when a cranial artery is blocked, or it potentially could be when it bursts. Part of the brain actually dies due to lack of oxygen, and some of the symptoms, there'll be a numbness of hands or face, difficulty speaking, inability to see. Heart attack itself, we talked about this a little bit before, was when those coronary vessels themselves end up getting blocked, often due to atherosclerosis. So if we call that myocardial infarction when we have a heart attack, and what happens is part of the heart itself is dying due to lack of oxygen. Remember, it's a muscle that's constantly working, so it needs constant oxygen exchange, and so if it's not able to get that supply, the heart tissue itself can die. And then an aneurysm is actually a ballooning of a blood vessel. So atherosclerosis or hypertension can lead to a weakened vessel and allow it to actually balloon out, and then which ultimately could lead to a rupture. And so those are most commonly found in the abdominal or up in arteries leading to the brain. And if those were to rupture, then it is most likely to cause death, because of the high pressure and blood flow in those arteries would cause a person to bleed out very quickly. So how are these disorders treated? You can treat a clogged artery with different types of surgeries. So often they will start with angioplasty, where they will move in a tube with a deflated balloon to the clogged position, inflate it, and sort of open up the vessel there. Often they'll do that in conjunction with a stent, where they are using wire mesh to help hold open the artery after they've opened it up. And then it's possible also to do bypass surgery, where you are using some either vessel from another part of the body or an artificial vessel to actually just put in a piece around the spot that's clogged. This just showing how that stent works again, and the inflated balloon to open up the arteries. If there's more disease there of the tissues itself, there are transplant and alternative devices. So it is possible to do a heart transplant if the heart itself is not functioning properly. There are other transplant or artificial devices available to replace part of the heart, and this is actually just showing a full artificial heart system that could be used. Other things you've probably heard about, things like pacemakers, if we talked about an inability to control a correct rhythm in the heart. And one of the main things to know about cardiovascular disease, and one of the important pieces to consider, is that many of the risk factors, many of the things that will help cause it, are actually things that are preventable. So some of the preventable risk factors include use of tobacco products, drug and alcohol abuse, obesity and sedentary lifestyles, so a lack of exercise, poor diet, stress, or poor dental hygiene. So it's important to consider all of those and to look towards plans where we can have healthy cardiovascular system. All right, so I hope that was a helpful review of the system. If you have any questions, let me know, and I'll see you back in class.